Hello, everyone, and welcome to today's webinar for mental health professionals, Walking Through Fire, Overcoming Pandemic Burnout, featuring Karen Cassidy. I would like to have us all please note that this webinar is being recorded and will be available as an on-demand webinar within 24 hours. My name is Sasha Zakard, and I am the Education and Membership Manager here at ADAA. Thank you all so much for joining us today. Before we get started, I just want to go over a few items so you know how to participate in today's webinar. You have joined today as a participant, and as such will be muted for the duration of the presentation. We've taken a screenshot that you can see here of an example of the attendee interface. You should see something that looks like this on your own computer desktop. You will have the opportunity to submit text questions through the Q&A feature featured in your attendee interface. You may send in your questions at any time, and we will collect these and address them during the Q&A session that is at the end of the presentation. I would now like to introduce our presenter. Dr. Karen Cassidy is one of ADAA's past presidents. Her areas of interest are anxiety disorders in children, teens, social anxiety disorder, treatment refractory OCD, and working with children and teens who suffer from both developmental concerns and anxiety disorder. Her research has focused on information processing in post-traumatic stress disorder and cognitive behavioral treatment of anxiety. Thank you so much for joining us, Dr. Cassidy. If you want, you can go ahead and share your screen now.
Okay. Sasha, I can't get a cursor to work here. I am so sorry.
No problem. Let's see.
I need your help. Yeah.
Of course.
There. How's that?
We can't see the screen quite yet.
Okay, let me go back to, sorry, I'm going to do this.
No problem.
Where's my share screen?
Thank you for your patience, everyone. This is what a live webinar is.
Okay.
I still don't see it.
I'm clicking on.
Oh, there we go.
Yes. Okay. Hi, everyone. That was a typical pandemic moment we just had there. And I want to ask you, what has the past year been like for you? And I don't know about you, but what has been the effect on your mental health and your attitude and your experience of work? Because I can tell you, prior to the pandemic, I used to do telehealth, several sessions a week. It would be someone would be out of town or they would live far away. And I kind of had this glamorous idea about meeting clients on video. It was this fun thing that I could do when I needed to send them out into the world to do practice, and I can be on their earbud, talking to them and seeing what's going on and secretly giving them directions, or having a session from a remote location. And I kind of thought, wouldn't it be cool to have that kind of life where I do telehealth? It seems kind of exciting. Well, by the 6th week of the pandemic, here's what happened to me. I was crying. I was using telehealth full time. I was feeling sad and grief-stricken and worried. And I started doubting my effectiveness as a therapist and having thoughts like, am I doing anyone any good? Why am I working? What am I doing to accomplish anything in this world? And by 6 weeks, I was so just not myself that I and 4 of my colleagues decided we were going to do telehealth from our office, so at least we could see each other and feel like we were getting out of our houses or away from our kids. And that saved my life. And the other thing that was tough was in the house I was living at that time while I was having my condo bill, I had 850 square feet. So my husband had to stay at his workplace because he couldn't even like burp or flush the toilet without my clients hearing it. And that was a big stressor for us. So me going to the office saved our lives and having my colleagues. Well, one of the dilemmas was my experience taught me several things. One is I was way more of an extrovert than I think I had appreciated. And I also hadn't appreciated what the healthy effect of a commute was on me. It gave me this transition time. And then I also didn't realize like what a strain it was to do all this telehealth. And I, in hindsight, was suffering from burnout, even though prior to the pandemic, I would have told you I have my dream job with my dream team staff. And I look forward to work and I look forward to home, and I wouldn't change anything about the nature of my work life. Well, the pandemic made that really different. So let's talk about what burnout is and why.
Karen, our
Getting my
slides aren't switching.
there. Okay, no. Why is my slide? Oh, there. Thank you. Okay, so it was like walking through fire for me to have to go through this past year, quite frankly. And it was something that was scary. I experienced myself as someone I didn't recognize as a professional, and everything seemed topsy-turvy. Well, when we look at research on burnout, we find that in professional burnout, it's something that's a little different from depression. Some people have called it depression from work, but actually it's something a little different. It's where we have mental and physical exhaustion. It's where we have apathy. We lose our joy and our sense of purpose. And so things that once seemed meaningful or purposeful or that had value to us just feel blah. And I was certainly feeling that. And then another thing we see is that we start to lose our ability to pay attention, to make decisions, to be creative, and we up our risk for mistakes and for accidents. And we found when people are having professional burnout, they're more likely to have automobile accidents, to have other kind of accidents that take them to the emergency room or require Band-Aids or bandages or ace bandages because they, tripped. And that it's actually something that is really bad for us and that we want to avoid. But I don't know about you, but I know one thing I felt was I felt huge pressure to keep working because I knew my clients were feeling burned out and scared and stressed and experiencing surges and symptoms like I had never seen before. And also, I felt financial pressure of, oh my God, what's happening? What's going to happen to my practice? Will we be able to keep working? How much money are we going to make? Can we, what's going to happen? So, let me talk a little more about, what are some of the general, risk factors here for burnout. So just across all professions. Well, one of the things is we see when you work beyond your capacity, and I'm talking about your functional capacity, not what your contract says or what your employer says or OSHA says. I'm talking about your functional capacity. When you work past your capacity and you have too little of the following, then you're going to guarantee burnout for yourself as a professional. So if you have too little self-care, if you have too little professional support, and what I mean by professional support, according to research, is you've got supervision, consultation, mentoring, continuing education, and then just informal chit chat where you're just commiserating with each other, laughing with each other, just sharing what it's like to be at work with other people as opposed to being in isolation. Also, we know if you believe that you are trapped, that you have no choices as a worker. And by that, I mean, you feel like you have no choices in the amount of work you do, in the amount of downtime that you have, break time that you have, or in the style in which you work, then you're going to guarantee burnout. So when you put yourself into a narrow chute and say, I can only do this thing this way, and it's not working for you. Another thing is that we see is that if you have lack of true vacation and change of setting, then that's going to set you up for burnout. And what's interesting is what we've discovered about the human species is we actually need a diet of novelty, and we need it pretty often. And we can't just keep doing the same thing over and over and over. And so part of the value of vacation and work breaks and coffee breaks and potty breaks and friends, going out with friends is novelty. It's not just the emotional quality of what's happening, it's the fact that we aren't doing the same thing. And so one thing I know a lot of us did, me included, is we didn't take vacations the past year because we felt like we couldn't. We weren't able to vacation the way we were used to, going to a tropical island, going to a resort, going to a special spot. And we started depriving ourselves of that change of setting, as well as a way to just get our head into a different space and to be more mindful or more relaxed or more enjoying nature. And we've also seen with vacation is if you had to pick between having 4 or 5 little vacations with long weekends versus one big long vacation, the one that's better for your mental health is the 4 or 5 little vacations. And we found part of the value of vacation is just the anticipation, as well as having the break from the same old, same old. And I don't know about you, but my experience of the past year felt like it was one big blob of the same thing. And it was really hard for me to kind of remember, like, what were the unique things that happened, even though they were there, because so much of it happened on the internet. And I had a pandemic pod of a small group of people. And until I got vaccinated in January, it was too much sameness for me. So what happens also when you get burnout? Because I mentioned apathy, is we also see another thing that's really dangerous for us as human beings. It's cynicism. And if you remember the research on, what are great attitudes for people to have, well, cynicism is not one of them. Cynicism is a risk factor for depression, for poor relationships, for feeling dissatisfied with everything. And we see that has really gotten there. And actually, I've seen a lot of that happening in our country, where it's gotten attached with attitudes about employers, attitudes about elections, about officials, about all kinds of things where we used to have more hope. We don't want to have cynicism about our patients. They need us to reflect accurate optimism about their chances for making their life better. Another thing that we also see is work loses its pleasure. So things that used to feel good to you about work are kind of like, who cares? Meh. Or it may even seem like just another stinking chore to have to meet with this patient again or to handle another call again. And then the other thing that none of us likes to admit is our effectiveness actually goes down as a professional. We aren't able to serve the way we want to, and things get more difficult in terms of how we intervene, and we really aren't as good as we would like to be for our patients. There's some specific stressors that are unique to the pandemic that I want you to be aware of, because our lifestyle of telehealth is going to continue. Even though I know I'm loving having more patients back in person, but we have the situation of children are not able to be vaccinated yet unless they're part of a study. And so we're going to have to continue to have kind of this hybrid life. So one of the first things I'm seeing is there's a shortage of mental health professionals, and we actually don't have enough of us to go around. And one thing that I am seeing from every single colleague I know is that their caseloads are full or too full, or they have a waiting list, and they're feeling immense pressure to have to see patients. And this is a direct result of the pandemic. And we see that the numbers, when we're looking at good public surveys of people that are having mental health problems, we're seeing up to 80% of people say, my mental health is not as good as it used to be because of the pandemic. And I'm experiencing more anxiety, depression, trouble with eating disorders, substances, all kinds of things, interpersonal distress, marital conflict, partner conflict, kid-parent conflict. And that's really tough. And we're seeing the rates are up to around 40% now in terms of people having diagnosable disorders, where for anxiety disorder, it used to be down in the 25% range, 23 to 25%. So there aren't enough of us. Another thing is we have had to reinvent the way we do therapy. And even though I used to use telehealth, and I would have told you prior to the pandemic that I and my staff are digitally competent. I hadn't had to deal with things like this. I'm meeting with a kid and their parent, and the kid figures out the fastest way to blow up the session is just run out of the room and out of the house. And then the parent runs out, and there I am with no one to coach, no one to talk to, and no way to help. And I can think of plenty of other things like that. Or having a kid do stuff like hide the phone or hide the laptop or hide the computer, and no one can find it, and we want to have the session. And those are just kid things. We've had other things happen that the ways we used to do exposure and the way we used to handle situations where there was a crisis. And that is a strain. And then the other thing that we see is there's not enough residential treatment or IOP or PHP. And one thing I experienced in the state where my practice is waiting lists to get into inpatient units. And so I had patients where we were doing all kinds of crazy things to help keep them safe in their home environment while we're waiting for an inpatient admission. And that had never happened before. So that's a stress. And in fact, one of the reasons we see it's a stressor is we didn't expect that. When I worked in Bhutan for 3 months, I knew going in that there were going to be limited resources. And so it didn't create a lot of pressure when I knew there was a waiting list for one of the 40 inpatient beds for the whole country. When I knew I had no PHP or IOP for patients, it was sort of a, okay, let's do what we can with what we have. But it felt frustrating to constantly be thinking about what I used to be able to do compared to what I could no longer do. Another thing that we see is a lot of us lost peer support. That because we were getting Zoom fatigue, it didn't feel as fun to get together with people because it was online. And we had to find our kind of sea legs with how we did that. And also, I realized that my social isolation from my parents, or not parents, patients, was painful to me to not see them in person. And then another thing that happens when you've got a mask and I can meet with people in person, I started experiencing this where I had some patients who were very sensitive, or all of a sudden they're getting mad at me or really upset. And it's because they couldn't see my face and I couldn't see theirs. And I was missing subtle cues and communication that could have tipped me off that we were getting near a very sensitive spot where normally I could do something to adjust what I was saying or doing with the client. And I couldn't do that because a mask made it more difficult. And it made it more difficult for some of my patients who were very sensitive about facial gesture to not have the reassurance that they needed by looking at me and seeing a full body of reassuring nonverbal gestures. Another thing that's been really hard for me is the constant uncertainty. And we know that's a trigger for worry. And I know for me, that set off worry in myself early in the pandemic, where I was worried about how am I going to work with my patients? What's going to happen? How long is this going to go on? There was a period where we kept thinking, oh, in another 2 weeks, we're getting back to normal. And it took a while to figure out things aren't going back to whatever normal is for a very long time. And also the uncertainty of, am I really doing a good assessment? Since I can't see this patient the way I'm used to, I can't experience the full panoply of their gesture and their tone, and I'm only seeing a certain part of their body, particularly with kids or clients who can't tell me everything in detail. It left me feeling a little unsure of myself and having to adapt to that. The last thing I want to mention is Zoom fatigue. It's real. There is some great research that was just released this week where they had 10,000 study participants. And the gist of it is Zoom fatigue is not only real, it affects women more than men. And if you're like the typical distribution of therapists listening to me, more of you are men than women. And we see that women are feeling more fatigue than men. And some of that may be because when you're in a group setting on a call, women tend to wait more to get permission to enter the conversation. So if you're in a team meeting, you're going to be more frustrated and trying harder to figure out when is the right time to speak up. And I don't know about you, but I've been in tons of meetings where there's just these awkward interruptions and pauses, and that's fatiguing. Another thing is we lose 15% of the nonverbal information that we normally get from someone's face when we are in the two-dimensional reality of Zoom. The problem is our brain thinks it's 3D, but it isn't, it's two-dimensional. And so we literally are having less information to read someone and to understand them. And so that problem I was mentioning earlier about clients not understanding us as fully as they used to, or us having the same problem, it's there. Another thing is we see that the constant near focus on faces is fatiguing. And also, when we have a great big face, if you have a really large screen, it creates a sensation of someone is too close. And if someone feels like they're within 3 feet to our brain, we interpret it as someone who's romantically interested or someone who's dangerous. And we're going to have that instinctual response, even though this is someone we really trust, we enjoy working with, just because of that odd phenomena of being too close. If you want to look up this study, it was done by Stanford, and it's been mentioned all over the papers. And then the other thing is that you have to exaggerate your gestures. So I don't know about you, but I'm doing a lot of, yeah, thumbs up, big smiles, trying to just put out more energy on there to compensate for that decrease in expressiveness in order to help my clients see who I am and to get an obvious message. And that takes energy. So those are problems for us that we have to compensate for. So let me talk about what are some typical mistakes that we know promote burnout that I see my colleagues and that I myself did. So number one is working too much and too fast. What you were capable of before the pandemic is not what you're capable of now. And one thing I saw in my staff and myself is I didn't have the same capacity for seeing the same numbers of patients or the same number of complicated cases at the same time. And this is something that hurt my professional pride a little bit early on, is thinking, what's happening to me? Because I like to think of myself as, I'm good about estimating what I can do and responding to that after having 30 years of practice or clinical work. And I realized I needed to take more breaks. And I had some clients that I realized I needed to pass along to someone else because they were just too much for me, or it just wasn't working well. And that was very difficult to admit that, and then to figure out how I could do that in a compassionate way. We see that what a lot of therapists do, and I see this all the time, is people stack up their patients. So probably what you have likely done is doing these things where you have a long day, so then you can have a couple days off, or having everything on 2 days or 3 days, so you have a full workload of 25 hours or 30 hours, and then you have all this time off. Well, quite frankly, that's not a good idea if you want to be effective and you don't want to be burned out. And Beth Salcedo, a past president of ADAA, was mentioning at our recent conference that one thing she had to do was have her staff schedule less hours and give them permission to do that. And one thing I know I did with my staff was ask them, what do you need? How can we help you? How can we make this easy? And giving them permission to say no to new cases, or to say, no, don't take any more cases right now. This is where you are at capacity. Another thing you got to think about is, do I say yes to too many difficult clients? So if you work with a population that's at higher risk for high risk behaviors, then you may need to think about, how much of this can I really handle? What am I really capable of? Are you the one that eats at your desk all the time? So you've got your coffee lined up and your water lined up and your snacks and your food, and you're just going to zoom through your day? I'm here to tell you that's a bad idea. And you need to be able to get away from your desk. Another thing that we see is, are you having too little contact with your professional friends? because a lot of us didn't realize how much passing each other in the hall at work and having those little chit chats or that laugh or commiserating with each other really, really sustained us emotionally and professionally. And one of the things that we did with our weekly group supervision for my staff is we changed it to more social time, where we did less working on cases and more just sharing with each other and just talking about life. And we found that was really important for our staff because we knew we didn't have those little daily interactions that we did. And then obviously I had a small crew where we were meeting in person at the office and seeing each other, and that was life-saving for me. Another thing is continuing education. So one thing I've seen people do this past year is short shrift themselves on continuing education and looking at it as I can get to it later. I've got too many clients now. There's too many emergencies. There's too much distress. And since I have time to put it off, I'm putting it off. And that's where you still need your conferences, you still need your CE. And I'm going to suggest you need live CE and you need live interaction, like this kind of thing, where you can interact with someone instead of just doing the thing where you read the article and then you answer the quiz. I'm going to suggest we need to have that interaction quality of our education to help keep us going. And then I want to remind you, you're the sum of the 5 people you spend the most time with. And if everyone around you or in your home is burned out from Zoom fatigue and pandemic burnout, then you've got to make an effort to find who are those colleagues out there that can uplift me and they're not suffering from burnout, because I need their energy and I need someone to role model for me how to lift myself up. Another thing that I see people doing is scrimping on sleep and doing it this way, where they're thinking, because I have extra time, because I'm not commuting, or I've stacked all my clients up on this one long day or these 2 long days, then I can kind of stay up later these days, and getting into this sort of sloppy, not getting your regular sleep, where you go to bed at the same time and wake up at the same time, and that's going to make things worse for you. So let's talk about now about what are the professional attitudes that I see in mental health professionals that set you up for getting into pandemic burnout. So the first one is thinking you have extra time because you're no longer commuting or spending as much time chit-chatting with staff in the office, and then also thinking that you can use that, that you never take advantage of that extra time. And then because of it, you stack up too much work. And I have encountered staff members of mine who have this, colleagues who have this, and you really need to think of it. Actually, I don't have extra time. The value of that commute time was it was transition time. The value of those chit chats was it restored me, and I don't need to fill that time with other kinds of work. I need to replace it with the same kind of thing that I had. And so one thing I've been doing with a lot of clients and with some staff is looking at, okay, if I'm not commuting, then what's a nice transition can I do that I can do? Do I need to listen to music or podcasts or books like I used to on the way to work, and sip my coffee or tea and kind of take my time looking out the window before I start seeing my clients or supervising or whatever I might be doing? Another thing I see a lot of professionals doing, and I admit I've been guilty of this at times, is do as I say and not as I do, because I am in the role of human services and there's so much need. And I hope you see the fallacy of this. It's the opposite of self-compassion. And what it's really saying is, I'm not as much of a human being as my clients are, or my supervisees are, or my students are. And it reflects a lack of self-compassion. and lack of insight into the deleterious effects of ignoring yourself. And when you don't respect yourself and your professional limits and needs for nourishment, then the problem is, whether you mean to or not, you're going to start to illustrate and negatively role model to your clients, to your family, to your friends, all the things that you're trying to do away with in the world. And how much sense does that make? Another thing we see is someone having the idea that, I've been in practice for quite a while now. I'm really competent, and we get this feeling of competency usually about 5 to 7 years after we've been working, and then we start reducing the amount of supervision and mentoring and peer interaction about going over our cases and our case conceptualization and our treatment. And the problem is, for the whole rest of our lives, we need professional input and inspiration and correction to help us become good. And you really want to be looking at this and saying, wait, I deserve all the same inspiration I got in graduate school. I just don't need the pressure there that I had in graduate school. Another thing that we see is procrastination. Okay, and this happens when someone says, I am so stressed, or I'm so tired, I'm so burned out, I'll get to it later, and they vastly overestimate how much time they'll have later. And then they do stuff like they put off things like progress notes. And this is the biggest area I have seen other people falling down, is getting behind in their progress notes during the pandemic, because they're stacking up too many patients. They're feeling tired and burned out. They can't concentrate. And then we know that one of the problems with procrastination is it just makes everything feel awful. It's hanging in the back of your mind. You can't really relax when you want to relax. And so one of the things I'm going to encourage you to do is to look at it as like, I want to have all my work done each day before I go to bed. And I want to teach myself to do my notes during my session. And this is one thing I try to do. My goal is, unless it's an intake, which takes extra documentation, is I'm typing away, looking at my patient, and having my notes done and sending them their homework in their next session by the time they walk out of the door. And to be able to feel comfortable to say, this is an important part of the session. Just a moment, I need to get this down. Give yourself that permission. And then the other thing I want you to do is, don't be so perfect about your notes. So one thing I know that happened to me in graduate school is, in hindsight, way too much effort was spent on writing perfect notes, and being convinced by people that at any moment something terrible would happen if I didn't have perfect documentation. Well, in reality, when I look at the huge volume of progress notes I have written and the number of times another human being has read them, we're talking less than 0.1%. And granted, I'm not working in a situation where there's a lot of court involved, but I want to ask you, what kind of notes do you really need? Do they have to have complete sentences, complete paragraphs? Can you use bullets, checklists? Just focus on what makes it obvious, what you did in the session, and what needs to be done. And so another person who is knowledgeable can read it, as opposed to having something that is worthy of a judge's scrutiny or your supervisor's scrutiny. I'm going to ask you to back off, because quite frankly, this is the biggest problem I've seen with my staff, is putting too much effort into progress notes that never get read by anyone unless they're on your team. And believe me, they don't want to read lots of long notes. The last thing is professional perfectionism. And this is something I want you to take an honest look at yourself. Have you ever had these kind of thoughts? No one else is as well trained as I am, because I came from a really good program. No one else at my workplace can do this thing as well as I do, or no one in my community does this as well. What they do isn't as thorough, it isn't as careful, they aren't as persistent. Because there's no one good to refer to, that I have to keep seeing this patient or keep working on it. Or, you know, other therapists aren't as thoughtful or careful or kind or thorough as I can be. If you have had those thoughts, and I want you to be honest because I've had these in the past, they are like toxic waste in your professional mind. They don't belong there. They're going to infect you with professional perfectionism. And the truth is, even if you were highly skilled and really competent, and 100 people would vote you best therapist of your city, you're not irreplaceable. There's so many other people that could also do a good job with your patients. And so I want you to look at these thoughts as these are the things that make you say yes when really you should be saying no. And you want to root them out of your life and ask yourself, why am I willing to believe something that I don't preach to my patients? Because the truth of it is none of us is that special. And none of us is all that. We're all human beings and we're here to serve. We're not here to be the best. We're here to do our jobs well within the range of our human capacity, which is going to fluctuate over time. So let's talk about some external problems that we know about burnout. So the first thing is we know that burnout is a workplace problem. And I hope you've been picking that up from me. And the largest chunk of the research on burnout shows that it has to do with working too much, too fast, too hard, thinking you have no choices, feeling that you have no support, no one's valuing you. So the first thing I'm going to say is, what about your workplace? Do you have a workplace that promotes burnout? And that what I've seen workplaces do over the past year is address burnout in an ineffective way. And research is showing this to be true. And that is they offer self-care apps. They tell people to take self-care. They tell people we care about you, but and then at the same time, they're saying you need to see more patients. You need to do more. You need to work faster. And that message doesn't work. And in fact, I have someone on my staff that left a workplace where they increased demand for documentation, for client census, for caseloads, and they had a huge flight of people from their workplace where they wisely realized, I can't sustain this. So you need to address the problem of overwork in your workplace and realize that many workplaces are paying lip service to addressing burnout, but they're not actually doing effective things. And I know if years ago when I worked for someone, it's very irritating to have an employer that pays lip service to this, but then basically you feel unappreciated and overworked and underpaid. And it's just not worth it, even if it's a famous place or a place with high status or a place where you think it's going to give you great training. So that's one, is you've got to be willing to say, is this really the place for me to work at? Is this really where I should be? And what can I do about it? Am I willing to talk to my supervisor, my boss, and do things so I can get rest, I can get work breaks, I have a workload that I can handle. And what I signed in my contract may not be the workload that I can handle now using the Zoom Live. And there's lots of research out there you can draw up to take into your employer and say, here, this is how much harder it is. And if, attrition is not going to help your quality or your workplace to lose me. So that's a dilemma. In terms of that is what's going on is your employer saying, give us more, you have to do more, and you can't. And then also, what if you are trying to take care of kids at the same time you're trying to do work? And your employer isn't able to help you work around that or do something around it. And we see, sadly, many, many women have made the choice of, I've got to, step out of my job, not do my work because obviously I have to put my kids first. And then that's something that may be difficult, especially if you're feeling like I don't have security about whether or not I'll get my job back. But you need to be willing to go to your workplace and say, I need less work, I need more breaks, I need more vacation, and I can't sustain what's going on right now. So I was going to say, what happens, I forgot about this, if you're your own bad boss, all right? Your employer is you. Well, that's where you're going to have to address some of the most common mistakes that happen in private practice. And here's the ones that I've seen people make. So the first one is saying, well, because the only way I make income is by seeing patients, and I don't have vacation pay, I don't have someone paying my life insurance, I don't have someone paying my health insurance, I better work more, or I can't take off as much as other people because I'm losing money. Okay, are you really losing money, or it's just you're not looking at it properly? Because the way you have to look at it as your employer only gets money when patients are billing fees, and they're reserving some of that to pay for these other things. And that's actually what you're doing as a private practice owner. And so you need to stop thinking of time when you're not billing is not lost time or inefficient time or time that somehow is bad. And the same thing, if you're an employer who has employees, you need to stop thinking about it that way too, as if my staff isn't billing, then somehow that's bad. You've got to step back and rethink that idea and realize all of these things have value, and all of them have so much value that I'm willing to pay for it out of the money that I collect from fees. Another thing is, I see people saying my practice will shrivel and die if I say no, especially if I say no to a VIP referral source who sends lots of referrals, or if I say no to someone whose opinion I really value. You know, they're more experienced than me, or they're my my supervisor that I used to have, or they're a third-party payer source that I really depend on. And I'm going to tell you that's incorrect thinking. And my experience has been that people will find what they need. And if you say no, more people will still come. You can always have a wait list if you want to do that. But there are more than enough patients to go around. And we're proving it right now. We do not have enough of us to serve everyone. And I am seeing so many ads from people like me and others who are trying to find people like you, that right now it's really a buyer's market in terms of finding a job in mental health. And so you need to remember there's more than enough patients to go around. There's more than enough employers to go around, and I can be selective. I don't have to put myself into a guaranteed burnout situation. So let's talk about what can we do to help you. So the first thing is, I want you to acknowledge that the uncertainty of the past year has had an effect on your professional self, and to take an honest look at what you might have accidentally been doing that promoted your own professional worry. And this is hard for us to admit sometimes, but how many times have you been comparing your social media posts to other people, listening to the caseload someone else is saying and thinking, wow, I don't have that many patients, or I'm not seeing that many, or noticing how many publications someone else is producing during this pandemic time and going, I can't even get my whole load of laundry washed and folded. I don't know how they're doing that. Well, this is good old reassurance seeking. And you know the effect of reassurance seeking. It's going to make you worry and then assume the worst is happening. And so I'm going to challenge you, stop reassurance seeking by noticing what others are doing and comparing yourself, and give yourself some grace and realize you're doing the best you can with what you have. And that actually is good enough. And that's all that our clients need from us. And that's all that the world needs from us. And we can't change that there aren't enough therapists immediately to address everyone's needs. Okay. The next thing, and this is a special one to those of you who are female, is how many of you are feeling uncomfortable with how you look on camera? And one of the things this study that Stanford did with 10,000 people is they found that women have screen anxiety about how they look. And that when you're noticing your, visage there on the camera, it's not only unnatural, we're not used to staring at ourselves, but if you have any anxiety about how you're coming across, then it's going to be a constant source of stress. And so I'm going to suggest you learn to just hide your face with a screen or set your Zoom or whatever so you don't have to see your own view. And also, I'm going to challenge you to do this exercise. And this is something a therapist had me do years and years ago that was profoundly effective for me in terms of feeling self-conscious. She had me look into my own eyes in the mirror and say, Karen, I love you and I'm here for you. And to repeat that until I could do it without crying. Because of course, when I started doing this, I started crying because I realized this is so hard to do. And I didn't realize how hard it was to do. And then at some point it felt like a relief to do it. I'm going to challenge you to do that where you look at yourself and you give yourself some compassion and love and remind yourself you're there and you don't have to be all that. Another thing is, I'm going to challenge you to stop worrying about money. Because as I mentioned earlier, there's more than enough patients. And if you need to work less to be able to live better, then cut back. And if fear of financial hard times is bothering you, then take advantage of, if you can, of pandemic relief programs. We did this in my practice. We took the PPP loan, and that helped me immensely, just knowing that we would be able to make payroll and pay benefits if for some reason we weren't able to collect enough fees, because a lot of my staff had to cut back substantially because of lack of childcare. Another thing is I want you to allow yourself to rest and to realize the amount of sleep and downtime that's proper for you is what makes you feel good, not what it seems like it ought to be. And in our culture, there's sort of this status with white collar professionals about being busy and getting by on a small amount of sleep. Where I'm here to tell you the average adult needs somewhere between 8 and 9 hours, and the average adult in our country is getting usually an hour or more less than that. And do what you need to get sleep. Another thing that I'm going to suggest you do is think about minimalism. Okay. And I've been following Joshua Fields Milburn and Ryan Nicodemus for years now. And they have some profound things to say, and you can see their TED Talk, or on Netflix, they have a great a great movie documentary called The Minimalists. And their idea is that you slow down and be mindful and figure out, what do you really need to be happy? Because stuff is not the answer. And you need to think about, okay, what am I doing that really gives value into my life? And what am I spending my money on that actually is necessary? And that is a really important question, because for many of us, the idea of what we think we should make comes from society and not from thoughtful analysis of our actual financial needs. And so I'm going to challenge you to think about, am I practicing in the right location? Am I in an office that's too expensive if I'm working for myself? Let me just switch to another one. Am I spending too much on my clothing because I think I should look a certain way because that's the kind of therapist I am? Am I spending too much on other stuff? And to do an honest inventory, because what I did when I started thinking about this, I realized actually I wanted to cut my lifestyle back a lot, and I did. And I sold my 5-bedroom house a couple of years ago, and I now live in a 2-bedroom condo that I absolutely adore because it's so much easier and simpler. And that, of course, takes off financial pressure. So I want you to think about, if you're an employee, I want you to think about, what's it going to take for me to approach management and ask for what I need? Do I need a mentor or a business coach or someone who can, or a therapist who can help me assert myself and figure out if my employer can't help me, where do I need to work? Do I need to go into my own practice? Do I need to find another employer? And as I mentioned earlier, they're out there. And another thing that I want you to think about is, who do you really want to be? Who do you want to be as a professional? Do you want to be the superhero that everyone's amazed at? Or do you want to be that person that approaches each patient with joy, that looks forward to going to work, your time off from work, that feels satisfaction because you're doing the right amount and you're not expecting too much from yourself? I'm going to challenge you to apply some of that ACT to your life and some of that self-compassion, and to consider scaling back. Because if you're at this seminar or this webinar because you're feeling burned out, I'm telling you, you're doing too much too fast and you got to slow down. The other thing that I want you to do is to be practical. I have here these blue light blacking clip-ons that I typically put on my glasses, and Sasha Seacard, who helped organize this webinar, has special glasses. You can get them for less than $20 from Amazon, and it can help you a lot. I've noticed that is really good. I want you to also think about, can I get patients back into my office? I'm vaccinated now. And to insist that people start seeing you there. And I've been doing that more, and we're finding it's joyful for both the client and myself in terms of, helping myself. Another thing I want you to think about is practical things in terms of, do I need to learn budgeting so that I can change my financial status, so that way I don't feel like I have to work so hard or work so much? Do I need to adopt a minimalist lifestyle? Because I'm the kind of person that has the values that say people come first and relationships come first. And that's what I teach my clients. And that means things don't come first, and houses don't come first, and clothing doesn't come first. It's about being comfortable and feeling good about who I am and where I'm going. So I'm going to give you my definition of professional success to try and challenge you to redefine yours. My definition is, my clients, my friends, my family feel that I love them and that I'm present for them, and that I'm going to be in an attitude of service and compassion and joy, and they're feeling my joy and enthusiasm. And another standard of professional success is, I'm learning and I'm getting creative and discovering new things all the time. And another one is, I make enough money that I can go on medical missions, I can do some travel, and I have time to spend with my friends and family where I can afford the food that I want to cook for them, or to eat out with them and not worry about it. That's my definition of professional success. And if yours is, I have to have a certain number of something, publications, clients, or whatever, I'm going to challenge you. You're looking in the wrong direction. You need to think about, is my definition about the kind of person I am to those around me, or is it based on these other false idols that are going to lead you wrong? So that's all I have to tell you now. I want to challenge everyone here to give yourself some grace, to forgive yourself for the mistakes you've made or the pressures you succumb to from your employer or your own mistaken thinking. And from the minute you hang up or put down this presentation, to start anew and to start to make those changes that are going to bring the joy back into your professional life that you always knew it should have. Thank you.
Wow. Thank you so much, Dr. Cassidy. I was enjoying every minute of listening to that myself. I would now like to open the floor to any questions. You guys are still open to submit, so if you have anything, go ahead and send it in. We did get one question so far, Dr. Cassidy, and it was about, how would you counsel clients who do not have the security or leverage to ask for a reduced workload?
Okay. What I with that kind of thing where I have a client where they're being pushed to work at a certain rate, is I want to, number one, help them understand you're not trapped, because some of the most interesting research is it shows that you have that idea, this is my only job, or this is the only job I would ever be likely to get. And so I work with them on first role playing. How could we ask in a way that's not going to put your job in danger? Ask your employer for changes. And then the other thing that I do is go out and say, let's go look and see what kind of jobs are out there for you. And what I find interesting is I've always been able to find stuff and to start saying, what would happen if you started applying? You can still stay here, but let's see what kind of options are out there. And oftentimes what that does is it starts to change that sort of fixed mindset that says, I can't get anything better, or if they're a mental health professional, I have to get licensed. This is the only thing I can do. And then I try to insert the idea this is temporary. So we take away the idea of this is forever, and to say it looks like you need to find a different employer. And I'll give you an example. I've had a couple clients that worked for Amazon, which is notorious for constantly increasing the work pace, et cetera. And so what I had them do was look at other jobs nearby, and to find actually they were eligible, and they both eventually got other jobs without having to leave Amazon and go into financial jeopardy. And so I try to give the idea, like, we are going to find a solution to this. This isn't where it has to end. I understand if someone lives in a rural area and there may not be a lot of options, that's different. In that case, one thing that we see when we read business news is that coming up with your own side gig actually is very effective for increasing income, and asking, do you have any hobbies or stuff, where you could leverage the internet, and for very cheap, you can get, build your own web page or do it completely on your own, or your own site, and use Facebook. And we see that the biggest growth mark for sales in terms of advertising is Facebook, where it's free. And we see that somewhere between 60 and 70% of women shop on Facebook. And I didn't know this, until I was getting some business coaching, and to give that kind of information to clients so that that could, help them kind of broaden their thinking and realize I'm not just in this one, little channel. Okay.
Yeah, we got some other questions that have come in. A very fun, quick question about our blue light glasses. So those are to help reduce the amount of blue light when we're staring at our computer screens. But we also have, what do you think is the minimum hourly amount one should accept as a master's level therapist working as an independent contractor for a private practice?
Okay, it's going to depend on two things. One is, do you accept insurance? And, in other words, does your employer have contracts with insurance agencies? And so I would want to find out what that is. I can tell you that for you to think about it this way is that as an employer, automatically, when I am paying someone an hourly rate, I have to add 38% to cover Social Security, income tax, all the things that I'm required as an employer to do. And then I have more percentage on top of that, where I have a simple IRA that I match with the full amount. And so you want to be probably thinking somewhere in the 50% of what their take is, okay, for anyone going in there, and sort of based on what they're doing. That one thing I do tell master's patients is, I see one thing horrible here in the Chicago area is, if you work for a public agency, they start you at $15 an hour, or at a hospital, and it's horrible. I can't believe that people are working for the same rate they get at Amazon. And so I would encourage you, if you're at an independent contractor, to look much higher than that. And so if you're in a place that charges more, for example, New York City or Manhattan, then you can, obviously 50% is higher. But I would try to think it like that, as like, I want to ask for around half of what my average bill per hour is, or standard rate, unless they're having a lot of, contracts where they're collecting a very small amount of money and they're trying to make money on volume. So I hope that answers your question. And then, oh, good question. New parents. Oh boy. Um, what I am going to say is, one thing I have done that's helped me when I became a new parent and was in my phase of children living in my home and working with them all the time. I tell my clients I'm a new parent or I'm a working parent. And that means that if you call me after hours, I can't vouch for being able to call you back right away. And if you reach me after 10:30 p.m. and before 7 a.m., I can't vouch for the quality of my answer. And I charge them for any professional time other than scheduling sessions. And I long ago stopped having a voicemail that says, I'll get back to you as soon as I can. And I tell them it's going to be hard for me to get back to you. And I also warn them I may need to cancel suddenly because my child is sick or needs me. And that took a lot of pressure off of me, because it's setting the stage of expectation with the client. And then the other thing I'm going to tell you is that first year, you just won't be able to work as much. And as you're finding out as a new parent, kids get sick. The average number of colds per year is 6. So every other month, and you've got all kinds of other stuff. And so I would look at it and say, this idea that women are supposed to be working full time and when they have an infant is one that I don't have to fulfill, and to be willing to give yourself some grace. And that's a mistake I made with my first child that I wish I hadn't. I went back at 8 weeks. I worked full time and I got sick constantly, and I got postpartum depression, and it was horrible. So I think it means letting your clients and your employer know what you're capable of and being upfront and honest, socializing them about your limitations, and then deciding that's just fine. Let's see. Oh, I love that. Taking things the wrong way. I'm so glad, Melissa, you are taking a vacation. You go. That is great. And let's see. Alicia, okay, managing increased caseloads and working with mandated clients. Okay. So this is one where I would suggest you and your coworkers get together and you approach your employer and say, we've got a problem here. We want to work for you. We want to do excellent work. We realize that we have mandated clients and we have a wait list. However, there's not enough of us. So what can we do to solve this problem so we can continue to feel good about coming to work and not put ourselves in a situation where your agency is offering substandard care because there's not enough of us? And I'm suggesting presenting the answer like that, where you try to create a collaborative situation with your, the I guess managers of your agency, because I'm sure they're interested in care. And the way I look at this is I'd say, well, that's absurd to say, if we don't have enough staff, we have to take everything that comes our way. That's a prescription for disaster. And I would even look up the burnout research, and it's very easy to find this research and to just show we're going to really compromise the quality of our care and decrease the mental health of our staff and absenteeism from illness and from mental health problems if we just serve everyone who comes to us without limits. And so I would also say we need to have other places to refer them to, and how can you help us with this? So that's my suggestion.
All right, thank you so much. Dr. Cassidy, that was wonderful, and I'm sure we all appreciate you answering those questions.
Well, thank you, everyone. Those were fabulous questions and shares. And I am hoping you can implement some of these things and start to feel less of the pressure, because I know it's been a terrifically difficult year for all of us professionally and personally. Thank you.
Yeah, we'd also just like to quickly invite everyone to register for our next upcoming webinar, Ethics and Self-Care for Mental Health Professionals, and that will be on April 29th. And if you are not yet an ADAA member, we invite you to view the many membership benefits that ADAA has to offer, including free CEs to eligible webinars. And a final thank you on behalf of ADAA and our presenter. We thank you all for joining us today. We hope to see you again. Thank you, Dr. Cassidy.
Thank you, Sasha. Bye-bye.